Approximately 443,000 people die each year from tobacco use. This is around 1 out of every 5 deaths. And what's even worse, our nation is wasting billions of dollars on smoking attributable expenditures. Policies need to be put in place to limit tobacco consumption. So what better place to start than by placing restrictions on the purchase of cigarettes? Tobacco use is the leading preventable cause of death in the United States. It has been and continues to be a huge nationwide health problem. It affects the health of the individual, society, and the environment. The Centers for Disease Control and Prevention state that 40% of non-smokers are still exposed to secondhand smoke. Smoking leads to premature death, increased healthcare costs, it carries a social stigma, is addictive, and is difficult to treat. Recent efforts to restrict advertising, to increase the tax on cigarettes, and to decrease the availability of cigarettes is a productive start to limiting their use. However, buying cigarettes in bulk continues to promote their use. While approximately 69% of smokers desire to quit completely, purchasing cigarettes in bulk saves them money and provides the smoker with a large supply of cigarettes. Buying in bulk is ranked number 3 in ways to save money on cigarettes. According to Stealth Health in an article of Reader's Digest, buying in bulk is ranked number 5 on the top 25 ways to quit smoking. Preventing the sale of cigarettes in bulk in South Carolina will limit their accessibility and affordability, thus reducing their use. Smokers are less likely to buy 10 individual packs of cigarettes at one time. If they have to go out of their way several times to travel to the store and pay more money per box of cigarettes, they will be inconvenienced and less likely to purchase or smoke a lot. Although buying in bulk allows smokers to save money, smoking places a huge financial burden on our nation. In 2004, South Carolina spent $1.33 billion on smoking attributable expenditures. In 2011, states collected $25.3 billion for tobacco taxes and legal settlements, but spent only 2% of the $25.3 billion on tobacco control programs. In a number of places with high cigarette taxes, smokers will travel to other states and buy in bulk to save money. A nationwide plan was incorporated into Healthy People 2020 to reduce the use of tobacco by adults and adolescents after declines in smoking prevalence stalled in 2009. A number of efforts have been put forth towards regulating cigarette use, but most of them are merely warnings, anti-smoking campaigns, or behavioral support. Although education is definitely helpful, preventive action is also necessary. Rather than simply encouraging and educating smokers on how to quit, it would be effective to implement a policy in the state of South Carolina that directly limits cigarette accessibility and affordability. Some current examples already in place are increasing cigarette taxes, smoking bans in public places, and not allowing the advertisement of tobacco. Smoking is still a huge problem, however, and the leading cause of preventable death in the United States. Purchasing cigarettes in bulk saves smokers an estimated $15 per every 10 packs they purchase. This motivation leaves those trying to quit with at least 10 tempting packs to get rid of or pass along to another friend. In conclusion, smoking is a continuing health problem that affects all of society. It is necessary to reduce tobacco use as we move towards a healthier nation and as we seek to achieve the goals outlined in Healthy People 2020 regarding the decrease of tobacco use. Education and preventive measures are great, but reducing the accessibility and affordability of cigarettes directly affects smokers. By preventing the sale of cigarette cartons in bulk, the individual's rights are not removed. Smokers still have the option of smoking. However, the policy is put in place to discourage it. Please take action. we can lower the percentage of preventable death from smoking in America.